Okay, we can start. Thanks.
Okay. Good morning, everyone, and welcome to the 15th European Patient Rights Day. I'm Brian Maguire, I'll be your moderator for today, and my colleague Jennifer Baker will join you tomorrow. The role of civic society and patients' advocacy groups for a more resilient healthcare system, lessons learned as we move towards a European Health Union. So this is the overall theme for these 2 days. Today we're going to focus on the health challenges faced by non-COVID patients. So the health challenges faced by non-COVID patients, that's our theme for this morning's session as well. So this is not all about presentations, not all about you just listening. We want you to send your questions to the panelists, your comments as well. If you can use the chat function for this, sorry, the Q&A function, not the chat, use the Q&A function at the bottom of your screen and send the questions there. Our team will highlight some questions for me to ask our panelists as well. But you can comment as well. Please make your comments relatively short so that we can read them out. And if you want to address them to a specific person, put that person's name in. And we'd love to know where you are and who you work with as well, if you're willing to share that with us today. But thanks for joining us. So our opening remarks and keynote speeches, let's kick off with Mariano Votti. He's responsible for EU affairs at the Active Citizenship Network. Good morning, Mariano.
Good morning, thanks, Brian. And welcome to the European celebration of the 15th edition of the European Patient Rights Day, the second one realized in this digital format. As you probably know, Active Citizenship Network, the European branch of the Italian NGO Cittadinanza Attiva, has promoted this multi-stakeholder event since 2007. And as its director, I'm very honored to celebrate this anniversary, especially in this difficult situation that we are all facing. I believe that each one of us remembers the episode, the moment that opened our eyes to the fact that our daily activities, our jobs, our lives have been turned upside down. Upon arrival at the airport in Rome, returning from my usual trip to Brussels, there was the Red Cross waiting for passengers holding thermoscanner. It was February 21st, last year, 2020. And in the same evening, we heard the news of the first death in Italy due to COVID-19. This is my first personal memory of what would soon turn out to be a global pandemic. After more than a year, this nightmare is not over. Although now there seems to be a light at the end of the tunnel. This is especially due to the enormous progress of science, given the speed at which highly effective vaccines have been produced, to the extraordinary abilities of the healthcare professionals, to whom we will be eternally grateful, to all actors who have worked hard to fight the pandemic, and to the high sense of civic duty that the population has shown to have in the vast majority of cases. However, we still perceive the urgent need to better address the consequences of the COVID-19 pandemic. Evidence collected during the crisis show that COVID-19 has had a significant impact, for instance, on non-communicable diseases. Indeed, oncological and chronic patients have been left almost alone for several months. Rather than recalling the impact of COVID, today we want to highlight the actions and the reactions that have civic and patient organizations as protagonists, actions realized despite the pandemic, and the reaction to put in place to mitigate its impact. In our experience as a civic organization, over 30 different types of initiatives have been undertaken in pandemic times to contribute to fight against COVID-19 in my country, Italy. Advocacy activity for cancer, chronic patients, and COVID-19 patients. Advocacy activity to guarantee therapeutic plans and continuity care. Solidarity for vulnerable target group. Concrete support to the general practitioners. Initiative focused on the citizens' empowerment. Civic monitoring. Political proposal initiative to restart, among others. To enhance the collective learning process induced by the pandemic, in occasion of this European Patient Day, we have decided to start from concrete, ordinary and extraordinary experiences that have allowed us to think about necessary system change towards more resilient health systems, in which it is also necessary to recognize the key role of the patient advocacy groups, the citizens' organization involved in healthcare issues, and more generally, all the actors that promote health as a common good. From their account of the pandemic, it emerged in particular a story that describes in a tangible manner the great reforming force of civic organization, capable of responding promptly to new needs by managing services, building alliances, quickly signaling necessary normative or procedural changes, mobilizing resources, both human and economic, introducing, promoting practices from which it will not be necessary to go back when everything is over. An activism and involvement in support of the institutions and for the benefit of local communities that is not really mentioned in the context of the proposal for a regulation of the European Parliament and of the Council on serious cross-border threats to health. The proposal reveals a lack which is completely unjustified, in line with the lesson that we should have learned from the pandemic. We believe that from today and tomorrow, discussion with institutions, associations, and experts, as well as from the constructive analysis of what has not worked, we can encourage concrete multi-stakeholder engagement to foster a stronger European health union. After all, this is an auspicious historical moment. Member States have just sent to the European Commission their national recovery plans, in which the issues of health is a key element. In a few days, the Conference of the Future of Europe will start, and we hope that health-related issues will be placed at the heart of the debate, as it will happen in the next Global Health Summit planned next 21st of May here in Rome, Italy. From the importance that will be given to health-related topics in this European political framework, we will understand if the necessity to create a stronger European health union, as underlined by Ursula von der Leyen, is merely a claim or the actual direction taken by the European institutions and the key point with which we will evaluate their work. We have understood at both macro and micro level what must not happen again in the future. Among the others, the selfishness and unilateral actions instead of solidarity and coordinated actions, as well as the limited access to different healthcare services. From the point of view of our organization, which promotes citizens' activism for the protection of everyone's rights, offering support to people in vulnerable conditions, it is not acceptable to respond to immediate needs of citizens facing the COVID-19 pandemic simply by closing services. Instead, alternative organizational solutions are needed to guarantee continuity and quality of care. All panelists who will participate in this year's conference have been invited to share experience, suggestions, with a specific focus on the resilience of healthcare systems. Well, before I finish my introduction, please let me remind you that today, among other things, we celebrate the Global Hand Hygiene Day. That could not be a more exemplifying image for a gesture, cleaning our hands, that we repeat dozens of times a day as a measure of prevention and personal protection. An image that, contrary to what is symbolically representing in the Holy Scriptures, today more than ever means taking care of our and other people's health. Finally, let me thank in advance all the panel invited, the Member of European Parliament, Brando Benifei, Pierre Delceau, the Director General for Health, for providing us the European Commission perspective, and of course, Brian Maguire, journalist, producer, broadcaster, with great experience of European policy business, for having agreed to chair the first day of the conference. Thank you all once again, and I wish you a worthwhile and interesting conference.
Ariano, thank you. Great,
Welcome.
great scene setter for what needs to take place over these next 2 days. Brando Benifei, the Italian MEP for Social Democrats, had intended to be here this morning. He's not able to join us directly, so he has sent a video message, which we're going to play just now as well. I think Bianca will play this for us just now. We have no sound, Bianca.
Dear friends, thank you for your invitation to the 15th edition of the European Patient Rights Day. which has now become a regular annual event in European national policy agenda to inform, discuss, and make commitments to strengthen patients' rights in Europe and in every member state. Since its birth in 2015, I've been a supporter of the MEP's interest group on patients' rights and cross-border health, because I'm convinced that there is a need to maintain a high level of attention on patients' rights and strengthening so the patients' rights across Europe, contributing to a stronger sense of belonging and European citizenship. Health is a prerequisite for the functioning of our society and our economy also. The COVID-19 pandemic is causing enormous human suffering and has a severe impact on health systems and health professionals. European citizens have increasingly expressed their expectation of a more active role for the EU in protecting their health, in particular as regards protection from health threats beyond national borders. We must listen to this reminder now, to this alarm, including in the context of discussions on the future of Europe. Attention should also be paid to the risk of widespread skepticism with regard to health measures, partly triggered by an increase of the misinformation on health issues. Health is a prerequisite for a dynamic economy that stimulates growth, innovation, and investments. So a strong European Union of health will protect our way of life, our economies, and our societies. But first of all, the rights of every person, the right to health of every person. The close link between saving lives and saving livelihoods has never been so obvious. With the publication on 2021, 24 of March of the regulation 2021-522, establishing a program of the Union action in the field of health for the period 2021-2027, the European Parliament wanted to give a strong and decisive response. The new health program, EU for Health, with more than 5 billion euros, is the fourth health program aiming to ensure a high level of human health protection in all EU policy and activities, in line with the One Health approach. The new health program certainly has the ambition to create the European Health Union with the objectives of improving and promoting health in the EU to reduce the burden of communicable and non-communicable diseases by supporting health promotion and disease prevention, protecting individuals from serious cross-border threats in health, strengthening the responsiveness of health systems, improving the availability and accessibility, including the affordability of medicines as medical devices, strengthening the health systems in their resilience and developing resource efficiency, addressing the implications of demographic challenges, and finally, but not last, as a point, the taking of the digital transformation. So we need to build on the experience that this severe health crisis has brought to us, and remembering that even before COVID-19, Europe's health systems were facing many challenges. Among the most well-known were the need to reduce waste and the use of health data in a better and more efficient way. Probably the aging of Europe's population is the main trend on which the spotlight was put before the pandemic and still represents the greatest structural challenge. When the population ages, the incidence of severe chronic diseases such as heart disease, stroke, and cancer increases. More than a year after Europe's first lockdown to fight the novel coronavirus, and with the imminent arrival of mass vaccination, it is certainly time to rethink the steps to be taken in terms of transforming Europe's health system. Looking at the last year, the pandemic has indeed accelerated some trends that were already starting, but were still in early stage before 2020. For example, the use of the telemedicine, which can be extremely useful for disorders that do not necessarily require the physical presence of for the examinations. So the impact of the pandemic on the health can now be described as for sure large and significant, but especially for the non-COVID health challenges. With the state of emergency, halting many health prevention and promotion activities with possible long-term impacts on people's health and inequalities, this is certainly a topic that we need to deal with. So it will be important in the post-pandemic phase to understand whether and how communities have changed, because prevention and health promotion actions will need to take this change into account, not only to improve the response to the pandemic, but also to recoup negative impacts on mental and physical well-being of our people. As you rightly remember, citizens have the right to be updated. Your continued commitment to involving citizens and associations across Europe to better understand and implement health policies is crucial for us as policymakers and for citizenship as a whole. So thank you very much, and I hope we can continue working together like we did in these years, so that we can have a European Union that is closer to attaining a real and fully compliant system of rights for European patients, like they deserve. Thank you very much.
Thanks to Brando Benefei, Italian MEP of the Social Democrats in the European Parliament. Next we come to Pierre Del Sol. He's the Deputy Director General for Health at the Director General for Health and Food Safety at the European Commission. Good morning, Pierre.
Good morning, Brian, and thank you very much. I would like to thank the organizers of having organized such an event, because the focus is really important and the theme is important. We need all of us to realize that, of course, health is important, but also health is important because at the end of the day, we are all possible patients. And so we need to make sure that we take into, the interest of patients. Now, as Mariano has said, we may see the light out of the tunnel with respect to the COVID crisis. Unfortunately, we are not yet there, but at least some positive news are taking place. But the fact that we are still in this COVID crisis does not mean that we should not try to understand what went wrong and learn the negative lesson of the COVID crisis. And we cannot ignore that not everything was perfect. And I would like maybe to focus on a certain number of points. And of course, you have certainly many lessons which can be drawn from the COVID crisis, but I would like to focus on a certain number of points. First message, and the first message is for everybody. Health really matters. We have all realized that investing in health is actually investing in our common welfare. It's not just, there was sometimes possibility to consider health sector not being important enough. And we have now realized that if the health sector is not working properly and, in a good condition, we will all be affected. And of course, we've been able to go through the crisis because of the huge efforts of the medical sector, because of the solidarity between our citizens, but still, investing in health is really something which is important and will continue to be important in the future. The second message also that we have learned, painfully during the crisis, is the fact that we need more cooperation at EU level. We cannot react to big crises in an isolated manner. So we need more interaction between the member states. We need more interaction between the different players at EU level if we really want to face global pandemic. And that's the only way to react. And again, if you look at the question of the vaccine, which I know sometimes is being perceived as sensitive, but without the EU action, what would have been the situation in some member states? And I'm coming from a relatively small member state, Belgium. So EU cooperation is fundamental in the health sector also. And I'm not talking about competencies. I'm not talking about changing the competence. I'm just saying real cooperation between the member states is fundamental. The third message, maybe the third lesson also, that we need also more resilience in Europe. I don't need to repeat, what we have learned during the crisis, but it's clear that we need to build more autonomy, more resilience in Europe. It's not building fortress Europe, but it's making sure at least that we have more means of actions in Europe. And maybe the last message also, and we are experiencing it now, is the fact that we live in even more than before in a digital world. Our world will be digital, including in the health sector. And we need to take benefit of this to see how we can improve the health sector by using also the digital and the possibility given by the digital technology. So those, I believe, are really important lessons that we need to put into practice and we need to continue to develop in the future. Now, the message, of course, and this is part of the title of this conference, is clearly we want to build an EU health union. And as you say, and it's very important that this day is not only focusing on the COVID, Because COVID, of course, is clearly something extremely important, but we should not forget, of course, that we have other diseases which are there and which are, of course, if not maybe not addressed in the same manner because of the COVID crisis. And so from a Commission point of view, we want to continue to work on this. We want to continue the effort of this. Let me give you a certain number of concrete examples. Non-communicable diseases. Still, most of our problems in Europe with respect to the health sectors are linked to non-communicable diseases. This is something which is extremely important, and we need to reinforce the cooperation between member states. We need to make sure, and that's what we are doing, that you have more interaction, more partnership, more development, more interaction between the member states in this context. That's the first element. A second element, you know that the Commission is adopting a European beating cancer plan. It's fundamental because for the first time, we have a plan which gives an holistic approach of the issues linked to cancer, trying to address all types of issues, all types of concerns linked to the cancer, from prevention up to when you have a cancer, what do you do when you have a cancer, what will be your life afterwards. So we have tried to address this in this cancer plan, which I believe has been well received. But if I may give you a message, adopting a plan is only the beginning of the process. What we need to make sure, that actually we deliver on this plan. We make sure that all the actions which are contained in this action plan actually becoming a reality for all our citizens. And if we are able to do it, if we are able, all of us together, to implement those actions, if we are able to do it, we might be in a situation where cancer would decrease in Europe. And I believe this is something which is important. Mental health also is something which is extremely important. And we know the situation in which many of citizens are because of the COVID crisis, but also outside of the COVID crisis. And as a Commission, we believe this is an important issue that we cannot ignore. And you may know maybe that next week we will organize a big event on this issue, which we consider to be a fundamental one and which affects a lot of citizens in Europe and will continue to affect it in the future. Next point on our table, and you see that's a long list, but I believe it's important because we want to cover all aspects, that's the pharmaceutical strategy. The issue, of course, of accessing, affordable medicines to all patients everywhere in Europe is a key aspect. We don't believe that they are second-class citizens in Europe. All EU citizens should get access to the same medicine everywhere. We know it's challenging. We know it's not always the case for the moment, but certainly we want to look and to see with all stakeholders, with industry, with member states, with patients, of course, how we can address this issue, which is a very important one. And this will be part of the pharmaceutical strategy. Next point on my agenda, which is, as I say, quite long, but it's an ambitious one too. It's European health data space. I told you digital is a very important element. We need to look at that digital dimension, and we need to see how we can actually use all the potentialities of the digital to make our health sector more resilient, but also more effective. And for instance, the use of artificial intelligence is something which is extremely important. You might have seen that the Commission has just adopted a proposal on the use of artificial intelligence in all sectors, including the health sector. And we believe this is something which could lead us to important innovation. Of course, and I need to insist on this, we are fully aware of the issue of data protection, and we know those issues are particularly important in the field of health, but we want to protect data protection. It's clear, we are fully aware of this, but still, we see huge potentiality for using more artificial intelligence, more health, digital health aspect to develop new research and innovation and to benefit at the end of the day to patients. And finally, funding, because if you don't have funding, you are not able to deliver. And as it had been already mentioned by the eminent member of the European Parliament, we have the EU for Health program, which is there, quite ambitious. Never so much money has been invested in the health sector at the EU level. And that's something we need to make the full use of it. We need to find a way to make sure that we really use this amount of money in a very efficient manner. And one aspect which also has been mentioned by Mariana, which is also extremely important, this is this huge recovery and resilience fund, where which is a fund which has been created to recover, to help member states to recover from the economic crisis in which we are, and where member states are now submitting their plans to benefit from this amount of money. And of course, health sector will be one of the priority of those plans. And for the Commission, it's certainly something which we consider to be very important. So as a conclusion, as you see, we have a long list of actions. But my fear, and also I hope I'm wrong, sometimes people have a tendency to forget, the negative aspect. We have a tendency to say, it went wrong, but it will be different in the future. I don't believe we can be in such an easy situation. We need to remind us all the time what went wrong during the COVID crisis, and we need to keep that in mind to make sure that when there will be a new pandemic, because unfortunately one day there will be a new pandemic, we will be much better equipped to face with it. And we need also to learn the lesson of the COVID crisis to make sure that outside of the COVID situation, outside of the pandemic, we simply are able to offer a better service to all our patients, to all our citizens. And that's really the message I would like on which I would like to conclude. We are all on the same boat. We have all interest to make sure that actually we deliver on this ambitious program, because at the end of the day, it will benefit to everybody, because all of us potentially, even if we don't want it, are potentially patients one day of the health system. Thank you very much, and I wish you an excellent 2 days meetings and conference.
Yeah, so thank you so much. Very clear message of ambition, as well as a pragmatic approach to how we get this done and what's possible in the near future as well as the distant future. So thank you so much to all our speakers for these introductions. Just to show you how wide the audience is today, just from the chat, I can see we have people from Madrid, Malta, North Macedonia, Italy, Spain, Cyprus, Kosovo, France, Galicia, and Spain. Also Brussels here, of course, Rome and Sweden. Those are just the ones who have commented so far. So, and Portugal, that last one in there from Manuela. Good to see you all. And so truly a pan-European conference of these 2 days. And I do love these conferences. We don't often see so many people comment so quickly. So an engaged and energetic audience. Ask you to send your questions for the speakers later at any time. You don't have to wait until they're actually speaking, and we'll try and bring some of those to you as well. Hashtag for today is EPRD 2021. EPRD 2021. Our social media team will retweet and post your comments as well. So use that hashtag, and it'll be paid attention to as well, so you can continue to contribute to the conversation. So let's move on to talk about concrete experiences in Europe. And our first speaker today is Kathy Apostolidis. She is president of the Hellenic Cancer Federation and a board member of the European Cancer Patient Coalition. So each of these speakers will have approximately 6 minutes. At 6 minutes, I'll ask them to wrap up if they haven't already done so as well. And then we'll try to get a couple of questions at the end. Kathy, over to you. The floor is all yours. Microphone on, please. You're on mute at the moment, Kathy. Yeah, can you switch your microphone on, Kathy, please? Perfect.
Yeah, okay.
There you go.
So thank you again for the introduction, and many thanks to Mariano for inviting me this time for presenting on concept on patient rights in Europe. And for me, it's something very important, since I have been involved in the European Patient Rights Charter since its beginning. And I have been attending and presenting in all the early events, but okay, since 2013, I had not got to be present because I had other commitments as vice president and president of ECPC. But we have indeed participated with members of my organization from Greece, the Hellenic Cancer Federation. So we are here all these years, and I am glad that the European Patient Rights Charter has been a precursor of the European Bill of Cancer Patient Rights. So this is a very important day for me. This the 18th of April, and now we are celebrating later because of the circumstances. And it has been, as the previous speakers have said, a very difficult, almost 2-year period, because all trends are that we will go more or less like this till the end of this year. So how this pandemic has affected the cancer patient community? It was really a huge blow, because from one day to the other, our treatments, our diagnosis, our appointments with doctors have stopped. We did not know what to do. We were scared to get infected. We had heard the rumors about how tragic the consequences for cancer patients could be if they got infected. And we did not stay stay idle, but we try to see what we can do to cope with the new situation. And the first thing that we have realized is that everything went mobile, everything was on the internet. But were our members ready to be fully on the internet? Unfortunately not, as it is the case in most countries. So we organized immediately last year in summer, June and July, trainings for our members on how to use the internet, how to write mails, how to communicate, how to communicate with the authorities for fixing appointments, for arranging meetings, for talking with their doctors, etc., because everything had gone online. This was not enough. As the news and the papers were produced, we understood that it was more serious than we had expected. And then the guidelines from the big oncology societies like ESMO, ECO, ASCO start powering in. Also, similar guidelines were coming in from national governments, from national oncology societies. It was very confusing for the average patient. But thanks to Associate Professor Davide Mauri, who is managing the oncology clinic at the University Hospital of Ioannina in northern Greece, he mobilized an army of Greek oncologists and foreign oncologists around the world, and they made a compendium of all guidelines that had been published so far, including national guidelines, so that it was very easy for the patients, for the cancer patients, to find what they should do if they want to get protected, if they had to prepare to go into a hospital because they were afraid to have contacted COVID, etc. So this was a great help. What else have we done? We realized that because of the lockdown, patients from other cities could not come to the big cities, Athens, Thessaloniki, and Patras, where radiotherapy, cancer surgery, etc. was available. So we contacted a bank, the Piraeus Bank, that has a big real estate unit, and the Ministry of Health, and we all three collaborated to make available to our cancer patients across Greece apartments fully equipped to cancer patients who would move from their city to a hospital in these cities.
1 minute, Kathy.
Our patients were very happy to receive this. It was very important because the hotels were closed. Relatives and friends were not very easy to accept other people. It was also not allowed to accept other people in your house because of fear of infection. So it was a big help. Davide Mauri has done the same thing now with the vaccination. All these 26 oncologists across the world, from Japan to Greece, through Italy, France, UK, Sweden, Norway, and many more countries, United Arab Emirates and more, have collaborated to translate everything in all languages. So patients in every country can find the information in their own languages.
Thank you, Kathy.
What else we have done? We have done much more.
I
in
need
February.
to stop you here. We can come back in just a few minutes, and you can add a couple other questions, comments in the Q&A as well. Thank you for that. Also, hello to Albania this morning, who's joined us as well. Denisa, good to see you, and Daniela and Rome. So let's go to our next speaker as well. It's Alina Constantine, and she's the from Patients Council and International Coordinator at the Ligue contre l'Obésité in France as well. Good morning, Alina.
Hello, everybody. I'm also very honored to be here with you today, and happy to communicate on behalf of the Ligue contre l'Obésité in France. So a few words about the Ligue contre l'Obésité. It is a nationwide organization regrouping all players in the field of obesity, and it was created in 2014. Today we count more than 9,000 members and 350 volunteers, including me, 8 staff members, and what's more important, 67 patient associations across France. We have a scientific council and a patient council. Our organization is agreed by the French Ministry of Health, and we are also a member of the AFERO, which is the French Association for Studies and Research on Obesity, of the AISO, and of the WOF, so European Association and World Obesity Federation. So our action during the pandemic was concentrating on defending patients' rights. In France, we had the feeling from the start that even though evidence was pointing extremely fast that people with obesity were at a higher risk than the general population, there were a lot of setbacks in the process of protection measures taken by the government. And you may know that obesity is not yet recognized as a disease in France. Therefore, the League's mission became defending patients' rights in all important aspects of their lives, which are health and work, because they were related. First, the government decreed that people with obesity were a part of the vulnerable population and granted the access to the partial unemployment and an isolation certificate, allowing people to stay at home. The family medic was the one to take the decision for both situations. But then, after the first confinement in August, the government annulled those rights through a new decree, forcing people to go back to work regardless of their BMI and the risk implied. So we reacted immediately and launched a procedure before the Council of States in order to obtain the annulment of this decree of September and the reinstatement of the more favorable decree from May. So a favorable decision was obtained on the 5th of October. Well, all this takes time, but it was a big victory for us, and a new decree was given with a halfway solution, making it easier, nevertheless, for the employers to control the medical decision, because the medical decision was taken by the work doctor, which was paid by the employer. In between, our director, Agnès Morin, was solicited for counseling by the Ministry of Health and the Ministry of Labor. So many remote meetings took place between them. So cooperation was still possible, of course, and that's what we are striving for. Another big victory is really recent from the last 2 weeks. And it regards the vaccination schedule for people with obesity. The logic behind the schedule was based on age and diseases combined. But people with obesity were left out of the equation, especially under the age of 50. We were supposed to be vaccinated with the other population under 50. And at the beginning of the summer, which was quite late for us. Even those presenting other chronic illnesses, such as diabetes or hypertension, could not get it in priority. So, for example, my valid husband, who is 51, would have been vaccinated before I would, and I have also diabetes. So therefore, the League organized a media campaign. It was a massive media campaign, and addressed the authorities, the government, the HIS, Haute Autorité de Santé, in order to change the logic of the schedule. And this initiative finally was a success, since the President Macron opened the vaccination for all people under 50 presenting obesity and the other NCDs from the 1st of May. So, well, our action was that we were on national television news programs, radio stations, newspapers, magazines, and therefore we raised awareness on obesity like never before. That was our feeling. And the public opinion was favorable to this decision. People were rather shocked that obesity was not considered a reason for prioritized vaccination. Of course, our main goal is to make happen a mentality shift change about obesity in France, and also determine or help the government recognize obesity as a chronic relapsing disease.
Okay, 1 minute, Alina.
Yeah,
okay.
And an NCD. And the COVID-19 pandemic upside for us is raising awareness and developing all sorts of communication and collaboration tools, and making it easier for separate initiatives to be intertwined and put together into stronger civic initiatives. So during this time, the League collaborated with the HIS, with the AFRO, with France Info Santé, which is an umbrella organization for all patient organizations, and signed several tribunes, had an impressive presence in media. And therefore, our vocation is of defending the rights of patients living with obesity during this time, gained a lot of visibility and legitimacy in the eye of public opinion and institutions. So, well, this is what I had to say for today. We did a lot of things also for patients, practical things all through this time, despite of the period. And well,
we mentioned some of those. We have other questions as well from the audience. Maybe we can bring some of those experiences back in a few minutes as well. Alina, stay with us for Q&A just a few minutes, and let's move to Stefania Vallone. She is with the European Programme for Routine Testing of Patients with Advanced Lung Cancer, and also with the Women Against Lung Cancer in Europe. Good morning, Stefania.
Good morning, Brian. Thanks for this invitation to Mariano. It's the first time for me to be here, so it's a great pleasure to share with you my experience. Just a few words more about me and my organization. I'm the member of the board of Women Against Lung Cancer in Europe. That is a non-profit organization founded in 2006 in Italy, and completely devoted to people with lung cancer and their families. In the organization, we provide information, education, help, and support, and we advocate to make sure that anyone who is diagnosed with lung cancer can live better, for as long as possible. So as I said, we are based in Italy and very active in this country, but during these 15 years of activity, actually we were able to build also a good network in Europe, and some programs like this one, like EPROPA, is carried out not only at national level, but also at a European one. EPROPA, as you said, stands for a European Program for Routine Testing of Patients with Advanced Lung Cancer. It's a support program for patients and was completely designed and developed by our organization, but not to address the emergency of COVID-19, but to offer a really concrete option to a significant challenge that is still persisting in lung cancer. That means the existence of barriers and inequalities in access to the timely and adequate diagnosis and the treatment options. That is unfortunately still a big issue, not only in Italy, but also in the rest of Europe, and especially in the eastern part of Europe. So why we decided to design EPROPA and how does it work? So the starting point to think about that was the consideration that the advent in the last 10, 15 years of the precision medicine have opened a new era in oncology and great opportunities for patients, especially in the treatment of non-small cell lung cancer, that is the main type of lung cancer. And the introduction of molecular testing and also innovative treatment in the clinical practice have offered the possibility to our patient to live longer and with a better quality of life, because normally this patient had a very poor prognosis. So that was a completely change of the scenario of this disease. But there is a big issue, because unfortunately, nowadays, the molecular testing in most of European countries are reimbursed only for the most common biomarkers, while there are a lot of new rare ones that were found in the last few years and that actually have treatments not available, but available in clinical trials. So a lot of guidelines, international guidelines, suggest and recommend the use of the next generation sequencing molecular screening access, but unfortunately only a small proportion of patients across Europe is available to receive a comprehensive molecular testing, because tests are very expensive and also the equipment necessary for performing these tests are very expensive and also very sophisticated. So this is the reason, because very few people are tested, and as a consequence also few people receive the right treatment at the right moment. So this is another big issue, the inequality in access to new drugs and access to clinical trials. So this is a big gap that need to be addressed and solved. And this is the reason because EPROPA was actually launched with these two aims, two specific aims: try to increase the detection of patients affected by lung cancer across Europe, not only tested for common tumor alteration, but also for the rare one, and also try to optimize their accrual, their recruitment into clinical trials. So how does it work exactly, EPROPA? EPROPA consists of two main phases. In the first one, our organization was, in collaboration with the Department of Oncology of the University of Turin, offer a free and comprehensive molecular profiling to patients with advanced non-small cell lung cancer, and all the hospitals in Europe that want to be part of this program, they should ask the approval to their ethical committee. After that, they can ship the issue samples to the central laboratories of the University of Turin in order then to determine if the patient has the eligibility to receive a personalized therapy or maybe to be recruited in a clinical trials. When we receive the results of the test, then there is the second phase, because there is the meeting of the molecular tumor board that is going to evaluate which treatment option could be suggested to the patient. Obviously, the treatment option should match the alteration that was found. And in this case, the patient will be proposed to receive the treatment that could be a drug already available, or that could be a drug in a clinical trials. And if this patient don't have any possibility to receive these drugs in the hospital where they are treated, our organization is going to support economic and logistic support to bring the patient and one of the caregiver to another place to receive the treatment. So just to conclude and to consider also the event that we are participating today, we are celebrating the European Patient Right Day. And for people affected by non-small cell lung cancer, not to have the possibility to receive the test means excluding the possibility to receive the best care, which is actually one of the fundamental rights of every person. And also the possibility to ensure to live longer, to live better, to continue to work, to enjoy the life with friends, with family, and to hope also in the future. So this is the reason because Women Against Lung Cancer in Europe, we know that we cannot solve the problem because obviously it's a big, big issue, is an international issue that not only an Italian one, but we believe that with this concrete contribution that we are trying to offer, we can help in some way to reduce at least the inequality in access to tests, to drugs, and to clinical trials. So this program at the moment is active in 8 countries in Europe, included Italy, but obviously we hope to have the possibility to enlarge to even more countries, to reach even more people who can have this opportunity.
Thank you, Stefania. We'll come back to that in just a few minutes. Excellent.
Yeah.
Thank you. Let's go on to Ana Castellanos. She's the project manager with the Platform for Patient Organizations in Spain. Good morning, Ana.
Good morning, everybody. Well, let me say it's a pleasure to be here, so thank you for having me. And I will start by introducing a little bit the Plataforma de Organizaciones de Pacientes, the Spanish Patients Platform. We are an umbrella nonprofit organization comprised of 29 national entities, which in turn bring together more than 1,400 regional and local associations. And we support 600,000 patients and their families across the Spanish territory and work to place the patient at the center of the health and social systems to raise their voice and represent their rights. We have worked and are still working on reducing the impact of coronavirus on people with a disease. To do so, we have been actively listening to patient needs through different studies. We developed an epidemiological investigation called The Impact of COVID-19 on Patients with Chronic Diseases in Spain, covering 3 different areas, not just the healthcare, but also the labor impact and the emotional impact of COVID-19 on people with a disease. And I would like to share with you some of the main results for later to focus on the action we developed. In the sphere of the healthcare impact, up to 69% of the participants in the study stated having medical consultations cancelled. 66% of those surveyed found their tests and interventions postponed until further notice, and the 31% of people stated they encountered different problems in obtaining their medication. In the sphere of the employment and the economic impact, 36% of people surveyed had to work in person despite being at high risk. And for 34% of the participants, the situation has caused a negative change, negative impact in their work situation. Another thing we want to highlight is the emotional impact of the COVID-19. Respondents were asked about their emotional state before the pandemic and how they felt during the pandemic. And the results reflect an increase in negative feelings such as worry, irritability, nervousness, difficulty sleeping, all these negative kind of feelings. They experience an increase of 40% points. For 41% of people, they feel the need for psychological support, although only 3% of them receive such a support. So in the light of these results, we work in different areas during the pandemic to protect people with chronic illness. And I will just expose some examples because the action are numerous, but let's focus on the main ones. The first one, it was to strengthen our free legal clinic service to provide legal advice to patients and organizations. Most of the consultations we received were focused on the work field. We also reviewed occupational safety protocols developed by the Spanish Ministry of Health to include special safety measures for people at high risk due to previous pathologies. Similarly to the French case explained by Alina previously, in Spain it was approved a status of temporary incapacity for work to protect patients so they could be in preventive isolation at home. We managed also to offer home delivery of medicine, of treatments provided in hospital pharmacies with some initiative, volunteer initiatives and agreements with some hospitals. And we are still defending the continuity of this service as it was shown very useful for those patients. So beyond this pandemic, we want to offer this for those who need it. And we also strengthen the collaboration and communication among patients, organizations, the administration, the scientific community, health professionals, and the rest of health agents to deliver rigorous information, and especially to combat hoaxes. We reinforce communication through our press office, creating contents such as press release, articles, podcasts. We organize online meetings and events to keep all agents informed. And finally, we have defended from the beginning the inclusion of chronic patients as a priority group in the Spanish COVID vaccination strategy. And to do so, we analyzed scientific evidence, and we conducted a study of the vaccination strategy of 6 European countries. So then we held meetings with the Ministry of Health, the regional governments, parliamentary groups, and other stakeholders, and presented this data. And we finally succeeded in getting chronic patients with more fragile clinical conditions included, but we are still working to push for the inclusion of all of the rest of the patients. We are currently members of the Communication Committee for the COVID National Vaccination Strategy, along with other agents. And well, this is just a summary of actions developed by the platform. I try to be very fast, like a cheetah. But please, if you have any questions or you need further information, I invite you to visit our website to ask the questions you have and take a look to other projects that we have developed. So thank you for your attention.
Thank you, Anna. We still got 5 minutes on this particular section, so I'm just going to go through some of the comments that are on the chat from different places. We have with us today, he's going to present tomorrow, but former Health Commissioner Vytenis Andriukaitis. Great to see you again, sir. If he's okay, I would just want to give you 60 seconds in a couple of minutes just to reflect on what we've heard from these experiences from the panel. If you can give us a quick comment before we go on to the next section. But I'll come to you in just 2 or 3 minutes. Let me go to the sections which we've heard for here. So Stephen McMahon from Ireland, communications was a big part of what each of our presenters, speakers spoke about there. Steve McMahon mentions that Irish uptake of telemedicine increased by fivefold during the pandemic. And I think that's interesting in the context of some of the others said. Ivona Machado talks about digital skills. And it's something Kathy spoke about at the very beginning as well. We functioning in Brussels and capitals, we're hyper digitalized. Our professional lives function that way, but that's not the reality for everybody. So a lot of people are excluded from telemedicine, from the remote access to healthcare because they either lack digital skills or simply the equipment as well. So the need, if we talk about a health union, clearly the digitalization of the health union must play a big part in that, even before we get to talking about data and artificial intelligence, like we heard from Pierre earlier as well. Cheryl was speaking about unequal access to screening as well. Again, there's a communications element there too. And just try to summarize the comments that have been made here, but something that strikes me from what the panelists said, that communication is critical, access to care is patchy, and that pan-European approach to the best services, the best care is fundamentally lacking as well. Stefania, your project is perhaps one of the more pan-European here as well. Are you optimistic, Stefania, that we're going to see a more integrated approach to healthcare as a result of the COVID crisis, and not just for lung cancer, but in a broader scope?
I want to be optimistic, obviously, because when you work with patients and with the life of people, you want to be optimistic, and everything that you daily do, it's in that direction. I should say that we really need the cooperation of any stakeholders in everything we do normally, because also, for example, in personalized medicine, that for us is really a focus. It's strongly necessary to involve not only scientific community, not only policymakers, regulators, but it's strongly important to involve also patient organization and to hear the voice of patient organization, a patient who daily live with this condition. So this is what we are doing here in Italy and what we hope to continue to do also in Europe.
Okay, Anna, just a quick response on, you spoke about speaking to politicians, basically a lobbying effort on a grand scale. What works? What do people listen to when you speak to them to convince them that action needs to be taken?
Well, for us, it was important to present data. That's the main reason we decided to start with this study with the COVID-19 impact, in order to collect real figures, real numbers, and also to do some benchmarking in the sense that what are other countries doing? Okay. What is having a good impact, a good result? So let's apply that also for us.
Okay. I remember speaking to Commissioner Andriukaitis at the time, and benchmarking, he said, was one of the things that Europe could do already within the current framework as well. But Vitanis, just in terms of what you've heard, what's your reflection on this panel? What strikes you?
Yes, thank you so much. I am a little bit confused because I spent 5 years in the position to being Commissioner for Health and Food Safety. May I say openly, I had very strong powers speaking about food safety. May you know that in Europe we have excellent food safety system which built from 3 grounds. One is at the level of producers, second at the level of member states, and third at the level of EU. But when we are speaking about public health and health, please keep in mind, your Lisbon Treaty do not allow to have more powers in public health. If you please read the Lisbon Treaty, please look at shared competences. You can't find something which be touched to health issues. Can you imagine that it is impossible now to cooperate and coordinate and supplement member states' activities? All my friends now in panel are speaking about coordination, about multi-level cooperation, about possibilities to have pan-European solutions. Yes, please look, European reference networks, we establish, but they are so weak at the moment. Because they are based on voluntary ground, and a lot of member states, as their governments, parliaments, are ignoring situation about cross-border healthcare situation. I know it personally. Can you imagine that we have no chance to see? For example, I always spoke about Europe in my pocket. You know, can you imagine, for example, to have pan-European screening card to all Europeans and to use it one time in 3 years, for example, to knowing that such screening would be financed by European funds? It will be excellent message to all Europeans, because it will be sense that we have something pan-European and we are treating all equally. Now inequality is very high. And we see second-hand patients. It's absolutely. Can you imagine that in area of rare diseases and rare cancers, some patients can wait only, speaking about diagnosis, from 5 till 10 years. Why? Because at member state level, they have no chance to be diagnosed. In Malta, in Luxembourg, in Lithuania, in everywhere. It means that they are waiting innovative treatment minimum 7-9 years compared to more richest countries. That's I will speak about it tomorrow. We need now, as never before, to speak about possibilities to amend treaties, to give more powers at pan-European level also, and then people's voice should be heard.
There you go. There's your message for today. And open the treaties. There's a treaty reform coming sometime. I think from what we've heard today, we have the networks to be able to lobby for exactly what from Commissioner has just said. This is something which just doesn't make sense anymore. It has to change. And we're going to hear more from Vytenis Andriukaitis tomorrow and his keynote address as well. We look forward to that. Thank you so much. We're going to move on to our next panel now for the roundtable discussion. And so let me just scan through who's speaking today, and then I'm going to ask each of them just for some short opening remarks as well to set the scene for what they want to speak about. And then we'll go to discussion and the Q&A as well. So you can continue to send your questions on the Q&A. Some people asking about the hashtag again for today. It's EPRD 2021. Please use that, and social media team will retweet your responses as well. So the roundtable we have with us today, Alex Filisevis. He's the president of the Alcan International and executive director at the World Bladder Cancer Patient Coalition. Great to have you with us, Alex. We also have Deva Brogin. She's the Vice President and Rapporteur on Patient Safety at the Standing Committee of European Doctors. We also have Lobna Selim. She's the Head of Medical Affairs and Developed Markets and JANS at Viatris. And Eric Teiser, he's the Senior Director, Head of Government Affairs at Teva Europe. And Sebastian Ares, he's the Global Access Policy Leader for Oncology at F. Hoffman La Roche as well. Alex, I'm going to ask you to kick off just a couple of minutes for your opening remarks.
Thank you so much, Brian, and thank you for the opportunity to join the meeting today and the panel. It was fantastic to hear also the examples just beforehand from different countries and really highlighting the impact that the pandemic had on patients across countries. So today, you know, I just wanted to say that there, undeniably, I think we all know that the impact of the pandemic on cancer patients was enormous and across other non-communicable diseases as well. And I think at the height of the pandemic, we had patients facing with suddenly canceled surgeries and treatments. And in many cases, there was no guidance as well, what could be possible to resume these. And if you can imagine from a patient perspective, being diagnosed with cancer and living with that inside you without knowing when you'll be able to receive care, And I think Anna touched on impact of mental health as well, and pairing that with isolation and emotional impact of the pandemic that cancer patients face should not be underestimated. And I think while screening and care services are climbing up towards pre-COVID levels, I think cancer services are still strained with a backlog of patients who have not been screened, have not been investigated or treated even during the pandemic. So, and to top it all off, we also have people who are still reluctant to access healthcare services because of that fear for their safety. And as was mentioned already, I think the impact on patient organizations should not be also underestimated. We had an increased demand on patient organizations, especially during the times of uncertainty and the height of the pandemic, who provided support, information, reassurance to patients at a time when resources were constrained and the financial and volunteer capacity dropped significantly. And without these organizations, I think the impact would have been much, much worse as well. And we must remember that these organizations are extremely important. Very few have received government support to date that we are aware of, or have been involved in any form of consultations. So to wrap it up, my kind of initial statement, I think, you know, whatever were the reasons for delayed and missed treatments that we have experienced, there is a growing number of patients who need urgent attention in terms of screening and diagnosis, or we face a really devastating effect coming very, very soon. And I think as we look into the future, we need to focus on patient centricity as we rebuild our healthcare systems in Europe, drive efficiency in cancer care and overall healthcare systems, reducing waste and focusing on improving outcomes for patients. And I think simply returning back to pre-COVID care systems is not an option. We must build back better for cancer patients and all people in Europe, and not just EU, but all of Europe.
Alex, thank you so much. Let's go to Diva. Diva Brogin, how are you? You're still on mute. There you go.
Thank you very much for the invitation to take part in this conference. I really represent the Standing Committee of European Doctors. And perhaps you will agree with me that every doctor has a duty to become the best advocate of patients' rights. And maybe I would like to make some insights concerning patients' rights during this COVID pandemic. As you know, it caused the crisis worldwide for healthcare and society. And of course, the states introduced a public lockdown, and perhaps it impacted the implementation, the realization of patients' rights. But I would like to talk about the patients with diseases that they are not COVID infected. They are non-infected COVID-19 patients. And I will try to talk very briefly about cardiovascular diseases, because as you know, it's the number one cause of death globally, and in Lithuania also. And in this context, I would like to share the research study, Medical Services for Patients with Cardiovascular Conditions during the COVID-19 pandemic, which was made at Vilnius University Hospital in Lithuania. The conclusions of this study were used to outline recommendations for better implementation of cardiovascular care during COVID pandemic, as well as to preserve these patients' rights to get the right help at the right time. The availability of healthcare services changed greatly during COVID-19 pandemic. It was more difficult for us doctors to provide both diagnostic and treatment procedures. The fear of becoming infected deterred patients with urgent conditions from seeking timely and effective help, thus diminishing their chances of preventing severe complications or even lethal outcomes. If to compare 2019 and 2020, the experts could provide evidence of the direct harm to the public health that was caused by strict lockdown measures and a subsequent decrease of the availability of healthcare services in Lithuania. For instance, it was noted that only one in every 2 patients with cardiovascular conditions could receive appropriate medical services in May, June 2020. The number of patients arriving with urgent cardiovascular conditions dropped by to 32% during the study period. The data revealed that during the first half of 2020, there were 34% more deaths among patients with cardiovascular conditions than in 2019. What is most interesting and I confused that deaths outside of the hospital setting increased by 14%. And finally, specialists reported that remote consultations were not as effective as expected and did not meet the standards of quality. So, as you know, a lot of strategies have different countries for cardiovascular events management in this time. The Lithuania also had, it was renewed program for these patients concerning their rights. But what I would like to highlight that Lithuania Association of Cardiologists took up the position of leadership and advocacy regarding the protection of the rights of patients with cardiovascular diseases. They published recommendations seeking to improve education of health professionals and the public during pandemic, giving the following messages. For example, cardiovascular diseases may be an emergency and treatment is available. The first visit to cardiologist must be contact visit if the patient has the chest pain or the shortages of breath. And a lot of very useful messages to the public. For example, how to improve healthy diets, how to increase physical activity. COVID-19 complicated the activity of people. Sudden, unforeseen, or stressful events during a pandemic may provoke to start tobacco use, drink alcohol. And in the conclusion, I would like to highlight that non-infected patients' rights during COVID-19 pandemic to assess and deliver care must be guaranteed. They have these rights, and government and healthcare professionals have to adopt mandatory restrictive measurements and to find very, very right balance. Thank you very much. I will try to answer questions if there will be.
Thank you so much. Excellent. Let's go to our next speaker, Lubna Salam. She's the head of medical affairs at Viatris as well. Good to see you, Lubna.
Same here. Thank you so much for the invitation. And as representing Viatris, I mean, I'm very proud to be part of this event, actually, which recognizes the efforts of citizens, volunteers, and healthcare professionals, really to put patient front and center and protect the patient right, also increase awareness on the most critical issues facing us as people and patients. So I'm going to briefly go over some of the activities that the private sector, represented. I'm representing Viatris, but this is actually a shout kind of to include the private sector into the public-private partnership, as we call it. And I'm going to share I have actually 6 examples. I counted them, and if time allowed, I'd be able to share the 6 of them. If not, definitely I can share the rest in the Q&A. So just before, I just want to highlight one thing from a non-COVID related. COVID aside, just listen to this sobering statistics. Every 2 seconds, someone between the age of 35 to 75 years of age dies prematurely from an NCD. NCD that goes into, like, imagine from the time we started this, the conference till now, how many patients suffer from that. Again, I'm talking COVID aside. And it's actually the COVID, understandably, has monopolized the global healthcare environment. I'm not definitely gonna talk into that. I think we talked to that in depth during the discussions. But also, I want to say that from an NCD perspective, the NCD patients are the patients that are mostly affected by COVID and also suffer from its consequences, including mortality. So that's kind of how sobering and how important it is to focus on people living with NCD. Looking into NCDs, I mean, we talked about 71% of total deaths. Specifically in Europe, we have, the objective of achieving healthy aging, and I'll speak to that in a minute, and some of the objectives, some of the initiatives we had. Cancer, definitely, we have cardiovascular on top, of course, and then followed by cancer. So there are, the NCDs definitely is, closing, it's a global burden from an economic perspective as well, causing $47 trillion between 2010 and 2030. So looking into some of the, what Viatris has done as an example of a public-private partnerships with healthcare and patient organizations. And that highlights the importance of including patient organizations in the dialogue. Viatris has a mission of helping patients stay healthier at every stage of life. And we have many examples to highlight. For example, we partner with the NCD Alliance on their program called Our Views, Our Voices, which is geared towards people living with NCDs. This program addressed real issues of people living with NCDs, and major themes evolved. Patient empowerment, it also promotes the shared decision-making between patients and healthcare professionals. And in the last conference, we had an evolving theme saying, nothing for us without us. So definitely that highlights the need for patient inclusion in the dialogue. We also partnered on Project Change with EIP on AHA to understand the gaps in healthy aging and for Europe. And that was a two-phase project. We did a qualitative assessment. We identified 3 key areas of focus. The need for integration, for a better integration of care, the need for improvement in adherence, and the prevention of functional decline and frailty. And once we had those, we identified those 3 gaps. We received a lot of proposals from many European countries, and we're actually now working with different countries across Europe in order to have tailored programs to tackle those issues. And definitely that's going to be shared once they are concluded by EIP, whether, again, as I said, improve adherence, improve communication to frail patients, and definitely how to leverage technology. And I'm going to come to that in a minute, how to leverage technology in addressing those issues and improve healthy aging. Looking into hearing the patients, we conducted a survey on patients, actually that was in Europe and the US, where we're looking into almost 5,000 patient survey, looking into the impact of the lockdown. We were hoping to have the impact of the lockdown and then post-lockdown, but since the lockdown kind of took longer than anybody expected, so it was like an extended, like the 2 phases came on the lockdown, and we're expected to launch, to publish the results soon. It actually sheds the light on the practical considerations for patients living with NCDs under the lockdown, from treatment access to the impact of the mental abilities and many, many other attributes. We also published a viewpoint where actually we're looking into, we had an advisory board of Patient and Caregiver Association last July, and we specifically wanted to present the advisory board's view on the role of digital health in managing patients with NCD during and after COVID, and to identify future direction based on patients' perspective. So 4 key learnings emerged. The first one is that technology developers should know that the goals of the patient may differ from those of the healthcare professionals. The second learning, patients, healthcare professionals, caregivers, and all the end users need to be involved early on to improve, to guarantee, I would say, usability, adoption of this technology. The digital health tools also must be better tailored to patients with complex conditions and multimorbidity. And also some patients simply don't want to or unable to use digital healthcare tools. We talked about, digital immigration. Those are not, we're not brought up with the digital revolution. So adequate alternatives need to be provided. So also, I want to highlight the patient-focused outreach, like Medicines in Europe, IGBA, and Viatris joined almost 300 other organizations to advocate a call on policymakers to resume cancer care and safeguard it through the pandemic. And that was publicized in the World Health Day on April 7th. That's definitely also signifies the great collaboration between public and private sectors. And that's important in order, as we always say, nobody can do it alone. So it's actually an example of how public and private can work together in unison.
Thank you, took the hand. Thanks so much. We'll come back in just a minute. I need to get through the other
Absolutely.
Excellent presentation. Thank you. Let's go to our next speaker, Eric Taizia. He's the Senior Director, Head of Government Affairs at Teva Europe. Eric.
Great, thank you. Thank you, Brian. Thank you very much. And it's a pleasure and an honor actually to join this panel for such an important discussion, and my big thanks actually for Mariano and for the ACN team to organize this conference on patients' rights and the impact of COVID-19. So COVID-19 pandemic had a significant impact, on health, social life, and economies, and it taught us so many different lessons. A lot of those lessons have been already actually, expressed this morning, but there are 3 points that I would like to cover. I think the first one, and I think maybe we've not actually discussed much about them, is that, the real heroes are still the doctors, the nurses, the clinicians, medical professionals, hospital staff who have worked relentlessly against the virus for more than a year now, under actually a lot of constraints. So I think it's very important, to still reposition all the efforts from the medical community regarding, let's say, the fight of COVID-19, a fight which is still very much actual in some country. Second, the importance to treat all COVID-19 patients, but also the non-COVID-19 patients without compromising their health. No one should be left behind. Thirdly, we must vow, I think, to never put our healthcare system under the strains they have been. And some of those healthcare systems, as I said initially, are still actually, fighting. And I think, let's say, really when it comes to the resilience of the healthcare system, there should be a general reflection on how to strengthen it. I heard a lot about cooperation between all parties of the healthcare delivering system through actually policymaking forums. I think this discussion is a good example that actually should not just happen once a year, but should happen actually on a regular basis. And this came out actually as one of the main points of a survey that Teva conducted last year. Because for, I think, a company which is touching the life of 200 million patients every day globally, I think it was very important for us to really understand the viewpoints from healthcare stakeholders. So would it be patients, pharmacists, hospitals director, physicians, and health centers. And I must say that there is 5 points that came out. I mentioned already one. The first one, again, it's cooperation. We need to keep the dialogue going on in order to have a sustainable, resilient healthcare system with all key stakeholders. This is extremely important. The second point, which has been mentioned, is actually to really look into access and prevention, right? So COVID-19 has exposed weakness within existing healthcare system. We've not actually maybe discussed those, but I think the one which are being certainly the most impacted are the vulnerable population. So I think this is an aspect that needs to be, more looked at, especially those with, multi-chronic conditions being also at greater risk. We've mentioned, that there is a backlog of diagnosis, screening, and treatment. For example, in cancer, we've also joined actually this call from the cancer community, which has been launched beginning of April. I think it's very important, but cancer is not the only one, right? So we need, really to enlarge our view and really work as a community. There is also a lot of fear, a lot of, I would say, anxiety, stress, which is touching patients. Stress actually and fears to go see that doctors sometimes. And we've mentioned, the role of digitalization, which came up again very strongly out of the survey. But also, through the whole society, I think within Teva, what we've done is actually to really, let's say, put a strong attention on health and well-being. Which has been very welcomed by our team, a team, which had to continue to work to produce medicines, to move medicines around so that patients could get their drugs, and very proud, on the resilience that we had as well on this aspect. And the last point I would say, which is, to look at and which came strongly out of the survey as well, is the role of the industry. First of all, recognizing that, we've been coping to, the best we could. I think that, we face an unprecedented situation, unprecedented, unpredictable, high spike of demand for certain drugs. I'm thinking about ICU meds, for example, but I think we've shown that, we could avoid major shortages through collaboration, through cooperation with the regulators. Again, it's like going back to the importance of cooperation and dialogue, but also showing the resilience of our industry. And last but not least, it's about innovation, right? Look at the vaccines and what we've been actually able to do in just actually a year time, develop a vaccine and make it available. I think this is fantastic, and certainly actually an effort, let's say, to be recognized. So those are like the areas that I wanted to put on the table today for our discussion, and which again came strongly out of the survey that we performed.
Tizier, thank you so much. Excellent. And let's go on to our last panelist before we just discuss this. And it's with Sebastian Arias from F. Hoffman La Roche. Sebastian.
Thank you so much, Brian, and thanks, Mariano, Bianca, and all the team behind this very important event. I'm very excited to join today's session, and I've been very happy to hear the previous speakers, because I'm very aligned to what they have said in terms of we first have to fight this coronavirus that have changed without any doubt the health systems, but also our personal and professional lives in a very impactful way. And Roche, in this sense, it's working very hardly in terms of developing testing and also identifying and developing potential treatments as well to treat this devastating virus. But we cannot forget about those non-COVID patients, and this is why we're here today, of course. And this includes the cancer patients, as it has been mentioned by several of my colleagues today. Just to mention a recent report from WHO in continuity of essential health services, it's after a year of the pandemic, almost every country is still facing challenges in terms of ensuring that patients can go back to the healthcare system. And I'm not talking only about cancer patients, but all kind of patients that it has been discussed already. One of the services that has been impacted the most is screening for cancer. And it's almost half of the countries that answered the survey that has been affected, and it's still being affected to it. And these will all have to think that it will be, and it will have a devastating impact, not only immediately, but in the years to come. Those patients are not being able to have access to an early diagnostic or to a timely treatment are gonna have to pay the consequences of the pandemic and the measures that we as a health system, as society, haven't been able to solve yet, right? What is Roche doing? And I like what has been mentioned before. It's not only one company, but we also have learned from COVID that we all have to come together to work against this virus. And it's through multi-stakeholder collaboration that we've been able to actually contribute by a local and a regional level. We've been working with ECPC, as it has been mentioned before, on how to bring patients to the front and how to generate their data that shows the impact that the COVID-19 is having on patients. This is something key. We have to show with numbers to policymakers and to society what is the impact of the pandemic. Also by ensuring continuity of cancer care. So we have around 100 affiliates worldwide that we've been working locally with those stakeholders, with patient organizations, pharma associations, and so on, to ensure that there is still access to treatment using telemedicine, digital platforms, but also for those populations that are not able to access these new tools, to actually make it possible for them to go to the healthcare systems and feel comfortable by going there, right? And the last point I want to mention in this introduction is the cooperation that we're supporting now with the European Cancer Organization, and it's the Time to Act campaign that is going to be launched actually next week, 11th of May. And it's a very exciting time, I think, because it's putting together all these stakeholders to actually say we can't wait more for cancer patients to go back to the health system and continue their treatment and avoid any bigger impact. Thank you.
Sebastian, thank you so much. All right, so let's fix Europe's healthcare in the next 20 minutes. I think it should be fairly easy. The themes that I see coming out of all of this, this from our speakers here: innovation, use of data, digitalization, and back to what Alex said at the beginning, but speed and safety in terms of screening opportunities, well, Sebastian just touched on too, and the continuity of care, and what Eric said about no one left behind. Yeah, and Lubna touched on this as well about we have to have alternatives to digital processes as well for those who are unable to access them, but also in terms of prevention, and what Daiva talking a lot about cardiovascular side as well. We have to be better at preventing the chronic diseases as well, so that the burden on the healthcare system is less over time. So a lifelong approach to healthy aging, I think, is critical here. So let's focus on the data first of all, too. So, Lubna, when you're looking at the data and looking at innovation, what matters to you? Is it market potential? Is it the needs of particular healthcare systems? You work in 10 different sectors, from oncology to nervous system. It's a broad range for you. What matters in terms of innovation in this sector?
I think what the data will be used to do. I mean, that's kind of like, especially if we're using the, for example, we talk about the AI, and recently there has been a congress on the AI in medicines for Europe, and the importance of collaboration with stakeholders in general, and involvement of experts. So I think the usage of AI in general, whatever disease state, where the need drives us, is very important. And I think looking specifically at the NCD patient, where you don't have really a clear-cut randomized clinical trial. Nobody has only hypertension, nobody has only dyslipidemia, but the guidelines are contrary to that. You have only guidelines for dysemia, dyslipidemia, guidelines for cardiovascular. So I think the evolution of the real-world evidence in order to look into the NCD's totality is key, and we have to be clever at that as a healthcare community, and we have to have regulations that help us, make this data useful and effective in either approving medications or really, kind of like advising on treatment decisions. So I think, not in particular area is the area where we have the highest burden of disease, and where we can provide meaningful, outcome for patients that are suffering from those diseases, is where we highlight our efforts.
Okay, and just on this as well, we've seen through the COVID crisis that there have been big lessons learned in terms of speed and capacity, and I'm sure those will be improved upon for our next pandemic, which probably is around the corner. So the idea that AI can drive innovation quickly and produce solutions quickly, and you need large data samples to get this right too. That requires different countries to pull together to get this done. Are you optimistic about the direction of European healthcare based on the experience and the lessons learned from COVID?
Absolutely. I think we have come now to recognize the I would say the richness that the AI can provide. And again, it needs, more regulations to help us, not more regulations in terms of to be regulated more, but, I would say optimize the regulations in order to help us utilize those evidence. Still, real world AI is still in infancy. And real world evidence is still used as supplementary data versus like randomized clinical trial. And whether we use this from a practical perspective, because as we say, we're looking now into, I would say, a burden that randomized clinical trial doesn't solve its problems. So we really need to have this innovative approach, kind of like looking also at innovation, this innovative approach into leveraging the data that we have, real world evidence, to help us combat this disease. So absolutely, I think that I'm pretty optimistic about the usage of data in the future, given the fact that we're also putting this in the center of our attention as Europe and other parts of the world as well.
Eric, on the same theme, if we're going to build a more resilient health union, and what does it take in terms? You spoke about integration, and how do you see innovation and integration working hand in hand here, and the community response? How is that built up in your estimation?
Well, I think the key is digitalization, right? So it's like this power that this new digitalized technology, let's say, can bring in order to interconnect everybody. And I think, again, digitalization has been a key lessons learned from this whole pandemic, with patients, wanted certainly to be more treated from home because, of fear of going to a healthcare system, or actually because it was more convenient for them. So I think, it's like I expect a strong acceleration when it comes actually to the digitalization of the healthcare system. The question is actually it's like, would we have the capacity in terms of infrastructure in order to, let's say, adapt our healthcare system? Would we have also the capability? I think, it's like there is a lot, let's say, learnings, it's like to be done for all healthcare actors regarding this, to empower them, like to use this type of technology. So I think really digitalization is going to take a strong, let's say, a strong kick moving forward. I heard, like we had a discussion about the funds, like previously and so on. Maybe that's an area that, like also the healthcare community needs to look at with the support of the European Commission, in order to develop this infrastructure, right? So do we have the right ecosystem to support this type of technology as well? Because this is new, right? This is the future. Like up to now, we are into simple molecules or biological molecules. Now, actually, we are in technology. So actually, how does that translate into like the healthcare system to be able actually to welcome that?
Alex, how does this translate for cancer patients? Does the data make a difference when it comes to lack of structural support? If you don't have enough scanners, you don't have enough doctors, does any of that make a difference if we don't invest in structural health services first? How do you see that in terms of cancer patients?
Well, I absolutely agree with what Eric said. I think in investment in infrastructure, making sure that we are able to deliver the services that cancer patients require should be the starting point where we start. I think if we look at what happened now during the pandemic, we had the mode of interaction between oncology specialists and cancer patients has changed as a result of this. And we use this innovation, telehealth, right, to mitigate some of the impact. And this is, of course, not unique to cancer care. So I think it's across the board with all diseases. There was a IQVIA report recently published as well that looked at kind of proportion of remote consultations in EU5 countries and how much of it was before, and they've seen increase. I think going up on average from 6 to 30 to 50%. Again, Stephen in the comments said similar things as well. And then when we look at the future, I think there's an estimate of about 20% that this could be increasing. But I think once, in that setting, we mustn't lose sight the importance of that patient-physician interaction. Yes, Eric mentioned that patients looking, some patients are looking to receive maybe care in the home care setting, etc. But there is an importance for that real life setting as well. It will not be acceptable for everyone. It will not be accessible to everyone as well. So we must really look from a patient side and patient centricity in that way. When we look at investment, I think, there's so much still in terms of work to do in equitable access, again, to cancer care. Across Europe, we have access to not just treatments, but care to, as you said, the radiology equipment, etc., that is lacking. And I think whatever we try to drive and improve awareness and access to diagnostics and treatment, if the infrastructure isn't there, we can shout and scream, but we will not be able to meet the demands. And I think that is absolutely one of the areas where more investment is needed. And yeah, I'll pause there for now.
No, just to follow up on this as well, I was reading a Bloomberg report a couple of weeks ago about diagnostic testing for the wide range of cancers, which is not commercially available yet, but the progress is good, and within 5 to 10 years, we're likely to have a very strong testing capacity as well. Now, if you put that into a community pharmacy or GP or consultation practice for the initial screening, this idea of innovation, moving things forward faster, getting access for patient care. Are you optimistic in this context that where we start with Lobna talking about the data, how we integrate that, when it trickles down to the patient itself, are you optimistic that within the next 5 to 10 years, patients will be able to use technology to get screening, to get access to healthcare more quickly as well?
Well, I'm certainly optimistic, and I have to be. I think that in order to really focus on driving that change, I think when we look at improving the quality and reach of cancer screening programs, I think this is the focus area for us to do. In bladder cancer, we don't have screening programs, right? But we need to look at also research and innovation. And as you said, there's a lot in the pipeline. So I'm really optimistic about that. Is there access to it? That would be another question, but we need to look at more smarter diagnostic approaches, looking at new screening programs, looking at risk groups, identifying those, and really looking at patient themselves, learning more about the patient and getting that insight from them to then be able to group them in a way in a risk group and making sure that we don't miss anyone. And for me, from bladder cancer perspective, what we need is really great, efficacious diagnostic tools in bladder cancer.
Thank you, Deva. When you talk about cardiovascular, Deva, you know, the idea that there's a lot of preventive elements involved in this too, which is public education. But you know, in terms of treating patients who are already suffering and have broader complications as well, you know, from what you've heard here, how do we build a more resilient service, and how do we build that into a pan-European context as well, Deva?
Thank you. I hope that during this pandemic period, patients need not only medical care, they need understanding, diligence, and psychological support. And on my opinion, it's the best way, it's more communication, more cooperation with the patients. For example, a lot of people, they had numerous calls by the government and throughout various medias to seek medical contact only in cases of emergency, but nobody concrete, not explain for patients what is that means emergency. And for example, another, these patients, as you had, they postponed their visits to hospitals, visits to doctors, because they're afraid of contacting with COVID-19. So in this aspect, the doctors have to explain that they will be safe, and this is misconduct, this is wrong thinking, and this is put them at risk for adverse outcomes. And this is the position that must do the doctor as advocate of patients' rights.
Thank you. Sebastian, if we look at real-world evidence, the real-world data, what encourages you? Where do you think the focus should be when we're talking about building resilient healthcare and treating non-COVID patients? What are the lessons learned from the COVID crisis here? Where do you focus?
I think the main focus is that we have to be flexible, right? That we have to adapt to the new challenges, and that we have to review what is the need from the patient perspective, but also from the healthcare system, and how do we respond to those needs. Just to give you an example, decentralized clinical trials, thanks to COVID, have become something that more than 50 pharmaceutical companies are adopting more and more, right? And I think that's just a small example on how we have to adapt. If COVID didn't happen, we wouldn't be there right now, right? So we have to turn this adversity into new opportunities. And that's where I see the role of data and real world evidence making the difference for us.
And the role of the European Union in this as well. You know, we haven't talked about, yeah, go ahead.
Yeah, sorry, go ahead, Brian.
No, we don't talk so much in this context about innovation and the funding from the European Union as well. You know, Europe doesn't have a direct authority over healthcare systems, but we have to invest a lot in healthcare innovation as well. And the Recovery Fund has the capacity to do that too. What would your advice be in terms of building resilient healthcare system and dealing with these issues in terms of screening and other elements? Where do you think the biggest bang for your buck is going to be?
Well, I think the role of the European Commission and the European Union is critical, and they have shown, just as an example, through the Beating Cancer Plan that was mentioned by DG Sante earlier today. I think having that holistic approach and going from prevention to quality of care through the whole patient journey, and having an actual plan for the entire region is already a good commitment and a good sign from the European Commission. And in terms of fundings, I think if we look at the Horizon Europe, that the EU for Health and several other opportunities that are happening right now for member states to apply for it, I think it's a good chance for us, not only as a private but public sector, to come together and actually look at these opportunities in terms of innovation, personalized healthcare, and bring those solutions into life.
Okay, so let's bring this question to Eric. This is from Andrea Zanaglio. If you have to pick two measures which should be taken as a priority to avoid shortages and ensure access to all patients, what would they be, Eric?
Yeah, thanks for the question. I think first of all, it is like, like our industry has demonstrated through the pandemic that, like we have a strong, resilient supply chain. I mean, we faced huge demand peak with, like no, let's say, no pre-signals before. When I'm thinking about ICU meds, for example, from one day to another, from a month to another, we move up, like the demand increased sometimes by 200% in some countries, right? So, and I think we've demonstrated that, like we do have the industrial tool to respond to that. I must say that the lessons learned also, we've not done that in isolation, right? So we've done that actually thanks to the dialogue that we had with the regulatory authorities, which give us, like flexibilities to move products from one country to another in order to cope with the demand. And I think that this dialogue is key, bilateral dialogue between regulators and industry in order actually to, let's say, to address shortages is very important. The second point is actually predictability of the demand, right? So because the huge challenge that we faced was very much like this unexpected dynamic. So the sooner we have predictability of the demand, and then let's say the better we can adapt our industrial tools and supply chain. So I think for me, that's really like the key moving forward actually to address, I would say, shortages. Maybe the last point is actually to ensure diversity of supply as well. We had this issue, with India closing its border to APIs that create a little bit of nervousness. So I think it's important that Europe really came strong with, like measures to support manufacturing investments in Europe, not actually for protectionism, because, like I'm against this. I don't think like this is, like the way forward, but more as, like ensuring more diversity in a global network. So really Europe playing its role there.
Thank you. We're coming close to our time. I'd love to speak more about the global supply chain on this as well, but I want to get a soundbite from each of our panelists before we close. And Lubna, let's start with you. Your key message. What's most important on the agenda? What do we need to do next?
Reinforce the private-public partnership and provide room for forums like this, more forums like this to collaborate and discuss. Excellent.
Thank you, Alex.
I would say we need to really look at the healthcare systems and in cancer care, my background, but healthcare systems overall, look where the inefficiencies lie, where there is a waste, and then divert that funding to improve the efficiency in cancer care. And the second point would be around really multi-stakeholder approach to all these challenges, patient centricity in everything we do, but also industry, healthcare professionals. Everyone need to come together on board and look for the solutions, because I think no government alone, no EU can solve this. So really working together it's essential.
Thank you, Alex. Deva, last word.
My very short message to everybody who take part in this conference: don't forget a universal right to screening from diagnosis, treatment, and continuing care for non-communicable diseases in order to continue progress towards sustainable development goals.
Okay, thank you. And Sebastian, your soundbite?
Sure. Just the first one is to continue working in collaboration to fight the virus, but also to ensure that no COVID patients have access to diagnostic and treatment. And the second one is to continue the learnings from this experience. I think we cannot forget that we have advanced quite a lot in terms of digitalization and data tools that we cannot forget once the pandemic has passed.
Excellent. Thank you. Eric, last word.
Yeah, I think, like everybody mentioned cooperation, and I could not agree more. Two things. So I think cooperation needs to be backed by clear fact and accountability. I think we forgot right now actually to really strongly monitor the impact of COVID-19 on non-COVID-19 patients, and maybe that's a call for the Commission to really actually, maybe do a study about this, right? So to really understand, what we are facing. And I think there should not be any way back. There should be only actually a way forward. So, and in that sense, urgently secure, safe access to diagnostic, screening, and treatments, right? It's like for patients, that's very important.
Excellent. Thank you to all our panelists this morning. I wish we had more time to spend on this, but the excellent contributions from all of you. So thank you for that. Also to our audience, we have been paying attention to everything that you've written, and that'll be consolidated after the event as well. But transparency of process and continuity of care, these are two themes that have been consistent throughout all the comments that you put forward as well. So thank you for your contributions. It's really much valued. And now just to hand over to Antonio Godioso for the final remarks as well. Good morning, Antonio.
Good morning, Brian. Good morning to all of you. Every time is, and thanks for sure for your work moderating this roundtable this morning. And thanks to everyone for participating, because it's always an emotional effect to see how many people around Europe are discussing about common issues, because if someone was forgetting, we are discussing about common challenges, common goals, common problems, and probably also common objectives to try to change using what we have learned during last year. To be honest, also hearing and following up about the discussion of this morning, there are some issues, some wishes, some fears about the future. I can share with you my fear about, for example, the national the forecast about health budget in Italy for the coming years. After one year that we are discussing about how is important the healthcare system and universal healthcare system, now in the health budget that is being published 2 weeks ago, we see that in the next 4 years the money, the investment on health budget in Italy are not increasing, neither are stable, but decreasing. So when you are discussing, the first feedback is, okay, but we have a recovery fund on the other side. We have the Next Generation EU that we are investing in this moment for the next 6 years. It's true, but when it's finished, and we are discussing about this, that we need not only investments, but we need also on the current budget the possibility to use money, for example, to recover so many actions that we were unable to do for the people with the chronic illnesses and so on. You know very well, because you have discussed about so many examples. So, for example, about all is related with the oncology. We have learned that we can have the possibility to use the diagnostics to have a more appropriate term of care to the people. So we need to use this kind of innovation to give more treatment to the people, to increase all the screenings that we have lost in the last year, and so on and so forth. So in one side, I have so many fears about the future. On the other side, I know that the civic community is becoming stronger and stronger, and they have the possibility to increase the voice also with the public institutions, both at national and European level. And this is the point, this is the key. Because when we are discussing, for example, about the Next Generation EU, the problem is not only how much money we invest, but also the accountability process. And when we speak about accountability process, is not only a problem of transparency, but about the concrete involvement of the civic leadership. And the involvement is not related about how I spend the money, but how I have the possibility to use the data that coming from the civic leadership to use at the best the money. Is also a problem of the public policies to drive at the best the resource that we have to change the future of the healthcare, both at the European and national level. So I think that is absolutely the key point that is related to our future. To be honest, I see that, and also on the basis of the experience that we have learned in last years, also discussing about results of the previous European Day of Patients' Rights, the problem is no more, or not always, to have a chair to sit around the table to participate, but about how this participation becoming effective. Because at the end of the day, is no more, I see, both at the European national level, someone that is saying, I don't want to involve you. No, most part of the leadership says, please come, participate, and then I decide as I like. This is not the point. If you like to change, this is the time that to use at the best the civic knowledge, the capacity to drive at best the choices that we have in front of us, and the knowledge structure that is represented by the community, by the civic leadership, is both a way to drive at the best the choices, and on the other side is a way to create a more strategic alliance between citizens and institutions. If institutions asking trust, they have to be able to give trust. And I think that is a fantastic opportunity that we have with Next Generation EU. And for sure, a common goal is to work together, is if necessary, to fight together, to give and to build up a new European framework that is the best investment for the future of all our community, both at national and European level. So thanks again for your time and that you've shared with us. It's always a pleasure and an honor to host this event.
Antonio, thank you so much. And thanks to all our panelists, all our speakers today. Tomorrow, kickoff is at 10 o'clock. You don't want to miss that. We have Vitalis Andriukaitis, who's already given us a taster of what you can expect tomorrow. So we're going to look forward to that. And please continue to send your questions and your comments using the hashtag as well. The team will pay attention to that. So my colleague from Euractiv, Jennifer Baker, will be leading tomorrow. I'm on justice tomorrow. We've got to fix the justice system as well, apparently. So thank you to all of you. Remember the hashtag, and it's on the chat as well, just in case I give you the wrong letter by reading it out too quickly. And thanks to Bianca and to Mariano and to the Active Citizenship Network team for all their sterling effort in getting us online, and all the excellent speakers we had today. It was really worth the time. Good to see you, and have enjoy the rest of the day. Thank you.
Thank you. Bye-bye.
Ciao.
Thank you.